Hi all. Today we are going to see about acute stress disorder. The acute stress disorder is nothing but the individual have the stress for a short period of time. Okay. Yes. Acute stress disorder is a mental health condition that occurs after a person experiences very frightening or traumatic event such as robbery, accidents, sexual assault, natural disaster, witnessing death or serious injury. Yes, acute stress is nothing but it is a mental health condition where the individual will be affected because of the natural disorder. It can be of anything. It can be of accidents or the natural disasters, or it can be a death of the loved ones. It can be of anything, but that will be for short period of time. Okay, the persons in that particular situation, the person feels extreme fear, hopelessness, helplessness or horror, and later develops psychological symptoms. It is called acute because it happens after the soon after the trauma and loss for short time. That's what they are telling. For example, it can be like trauma means a childhood experience. For example, if an individual is having fear about dark. Okay, so if that individual witness a death in that dark place, means that will cause a trauma to that person, but it will be for a short time. Okay, it won't be like chronic. Okay, the next is causes. Why it causes? Okay, when does it start and how long does it last? Okay, symptoms starts within 4 weeks of the traumatic event. Like symptoms mean they will be having like a fatigue, help, like they will be like having a sorry, extreme fear. Okay, numbnessness, sleeplessness, so all these will be having. So the symptoms will start from fourth week, within 4 weeks of the traumatic event. Okay, if an event has occurred, the symptoms will start after the within the 4 weeks. Okay, and the symptoms must last at least, for example, if the person is having a trauma, that particular symptom should at least occur for at least 2 days. Okay, then only we'll say that it is an acute stress disorder. Okay, symptoms last more than 4 weeks, last not more than 4 weeks. It should not exceed more than 4 weeks. Okay, if symptoms continue beyond 1 month, it may become post-traumatic stress disorder. Yes, if the symptoms is if they are having the symptoms more than the 4 weeks, okay, that is more than a month, there will be a high chances of getting post-traumatic stress disorder. Okay, the next is, what are the symptoms the person will be having? Okay, a person must have several of the following, like as we said, right? The symptoms must last for 4 weeks, or that particular symptom must have least for at least 2 days, occur for 2 days. So what will be the symptoms? Okay, even causes fear, helplessness and horror. Okay, feeling numb, as I said, feeling numb, detached from emotions. They will be detached from the real world, feeling like you're not yourself, like they won't have the self controls. Okay, they will be having nightmares. Okay, bad dreams or nightmares or flashbacks. Irritable, they will be always irritable, they will get angry quickly. Okay, trouble, they can't fall asleep, and they can't concentrate on a particular work. Okay, problems in work, not due to drug or medical illness. Okay, the next is treatment. What are the treatment we can give for the acute stress disorders? We can give psychological first aid, trauma focused counseling for that particular individual, stress management techniques like relaxation technique, breathing exercises, all these can will give. And we can ask the family members to uh, give a support. Okay, like family members, friends, peers, we can ask them to give and support for them. Then medications, if the symptoms is very severe, if the disorder is very severe, we can prescribe some medicines. Okay, the next is, what will be the criteria of yes, as we saw earlier, there is some criteria that should match that individual symptoms. So then only we will tell that it is an acute stress disorder. Okay, the diagnostic, yes, the first is recurrent, involuntary, and intrusive distressing memories, like that is the nightmares or flashbacks. In children, repetitive play may occur in which themes or aspects of the traumatic event are expressed. Okay, these are the symptoms that particular individual should have. So then only we'll match this and we'll tell, yes, this is an acute stress disorder. Okay, recurrent distressing dreams in which the content and or affect the dream and related to the events. Note in children. Older than 6, there may be a frightening dreams without recognizable content. Okay, next is dissociative reactions, like it can be like flashbacks in which individuals feels or acts as if the traumatic events were recurring. Such reactions may occur in a continuum. The most extreme trauma specific reenactment may occur in play, okay, in children's. Okay, and intense or prolonged psychological distress or more physiological reactions in response to internal or external cues that symbolize and resembles as an aspect. So all these symptoms should match, not all, at least three of the symptoms should match to the individual's symptoms. So then only we'll diagnose this as the acute stress disorder according to the DSM-5 criteria. That is the diagnostic and statistical manual for psychological disorders. Okay. Yes. Yes, thank you.